conceptually speaking, we all agree that these models are absolutely what the marketplace, providers, and consumers need. It will result in better access to care, more timely delivery of care, as well as hopefully better patient outcomes. All right. The flip is you have consumers that have choice. Okay, so it depends on the market that we're also talking about, whether it's the commercial space, small group, whether it's the Medicaid space or the Medicare space. And then the successful engagement of a consumer to then say, oh, let me also be proactive in my self-management. Let me respond to a piece of mail that I get. Let me call my doctor's office back when they call me and say, hey, have you actively been taking your insulin, to manage your diabetes appropriately? And having that level of consumer engagement is the flip of these programs that are required in order to have a successful program and to have these kind of alternative payment models work. And without that, we're going to have to, face problems. It's long and short of it. So this conversation is great because basically we're circling around a point that I think we're all may agree with, is this concept of aligned incentives, right? That's really what we're talking about here, is how do you get, yourself as the consumer to have the same kind of, let's be honest, financial incentives as your primary care providers, your insurer, your employer, right? Because that's who's footing the bill in a lot of the times, to all say, okay, it's no longer just them paying the bill on my behalf and I can do whatever it is that I want. Fundamentally, the costs that you incur ultimately do come back to you. So if you are better and more proactive in self-management, in saying, oh, geez, should I have lifted that heavy box that throughout my disc, or should I have tried something different? It all kind of will culminate in this collective improvement to the system and ultimately to the bottom line and better outcomes and better patient care. Part of the fundamental issue at play here isn't necessarily the concept of reference-based pricing. It's a larger issue of we actually just have a pricing problem for healthcare in America. That's the larger issue at play here. More or less, more carriers, more payers, more providers, everything stems off of basics of some point of the Medicare system in some way, shape, or form. So, that's Medicare Market Basket, that's MedPAC, there's a whole host of policy implications that drive the pricing system that exists in this country. And then you have the regional pricing that's going on. I don't know if anybody pays attention to what's going on in the news, but for instance, the New York Presbyterian system in New York City is having a major public fight with Empire over the pricing of its healthcare, and a large union is actually standing on the same side of the insurance company and pointing out at the hospital saying, you cost $25,000 more, $50,000 more on average for the same procedure as the same guy down the block. So again, I think it's a larger issue at play for pricing. I don't think there's one kind of magic silver bullet that's going to cure how we pay providers and incentivize them. It's a larger discussion at play.